is It's Clinician's Corner with Dan Cahigas. Here's Dan.
And welcome back to Clinician's Corner. I'm your host every Saturday from 3 to 4, Dan Cahigas. And we have a fantastic opportunity today for all of our listeners. It's a wonderful interview with Dr. Chris Kammer. But I want to remind all of our listeners that our sponsors provide us these wonderful guests. They provide the opportunity to have the relationships in these interviews. So for more information, I would like a lot of our listeners to really take advantage of the information that Dr. Kammer is going to be giving us today, and you can do that by visiting Xlear, XLEAR.com. It's XLEAR.com, and we're going to be talking about Spry dental products, which are available at Vitamin Shop, Whole Foods, Sprouts, and other fine health retailers nationwide. And again, you can find them at Kroger as well, and their website here, that's XLEAR.com. Now, today we're going to be talking about oral systemic dentistry, and our guest is Dr. Chris Kammer, and he's been a progressive voice in dentistry for more than 2 decades, seeking out emerging technologies and approaches, and his work with the oral systemic approach, a recent movement in medicine and dentistry that improves general health by optimizing oral health, has helped many of his patients gain increased resistance to chronic disease, including heart disease, stroke, diabetes, and some types of cancers, and Alzheimer's, as well as preterm birth and obesity. Dr. Kammer works with all of his patients, but especially the kids, to brush, rinse, chew, and smile. And when it comes to xylitol, oral care products, and improved dental overall health. Welcome to our show, Dr. Kammer. Doctor, how are you?
Dan, I am fantastic. It's great to be here with you today.
This is a topic for me that hits close to systemic health and home on a couple of levels. This is an emerging level of medicine. Certainly I've attended now the Association of Oral and Systemic Health and seen some fantastic lectures. I've learned just how important the gut-brain mouth connection is. I mean, we hear so much about the microbiome, but it really does start in the mouth. And then I have a little 3-year-old who's going to be 4 next month. So the importance of oral health to me has a personal level because of my daughter. And then overall, that this is a very new area of medicine for many, many patients. They're not used to having to worry about oral care as a part of their overall health. So what got you into the world of oral systemic dentistry, and really what is oral systemic dentistry?
Oh, my goodness. Okay, great. Well, fantastic. Well, I think that, the mouth is the only part on the body that really is connected to other parts. So, once there's that entry point for the mouth into the circulatory system, your bloodstream, and the things you swallow that get into your system as well. It should be the first place to start to be healthy. And for people out there to think, well, I'm a healthy person, but you're not healthy if your mouth isn't healthy. And that really is the first place to start. Let me break it down to you like this. Time magazine came out a good number of years ago with a cover story. And the cover story was about the secret killer. Now, the secret killer is inflammation. In fact, nowadays, any doctor you speak with will say that, yeah, chronic inflammation is the secret killer, and it can lead to heart attacks, colon cancer, diabetes, atherosclerosis, I mean, on and on and on. So with the secret killer being chronic inflammation, Dan, the number one place for inflammation on the entire body is the mouth. It's gum disease. So with that being the most common place for chronic inflammation and chronic inflammation being the secret killer, you'd think that would be the first place to get healthy. So that's one of the things that kind of got me on this track, mouth health related to body health. But the other thing was that as a cosmetic dentist, my father, Jack Kammer, founded the American Academy of Cosmetic Dentistry, and we enjoyed the golden age of dentistry when all of a sudden everybody's come back to the dentist to get a beautiful smile. But Dan, there was one thing that wasn't beautiful that I saw over and over again, and that was the bleeding in the gums. Gums were bleeding, and people were just time after time just expecting that gums bleed, and the dentist would say, well, you need to floss more, you need to do this, do that, or whatever. We just didn't think that it was possible to stop gums from bleeding. But I will tell you that those bleeding gums are the sign of the chronic inflammation that is the secret killer, according to Time magazine. So I set out on a journey to say, what can I do to get this to stop? How can we, as a profession, we've got to stop accepting that gums bleed. Healthy gums do not bleed, okay? So let's just make that clear, put that right out on the table. And I sought out on a path to do everything I could to bring to my patients and the rest of the dental community a system that would get gum health under control, get mouth health under control, especially as it relates to the health of the rest of the body. So that's kind of how it all got started.
And, it's interesting because you were involved in cosmetic dentistry and were considered the poster boy of the industry. What do you feel about cosmetic dentistry and what it's done over the last 20 years as well?
Well, what's amazing about cosmetic dentistry is that now people were coming to the dentist because they wanted to. I mean, a lot of people felt like, well, I got to go to the dentist. It sort of was one of those necessary things they needed to do. They didn't always look forward to it. Listen, I get it. We're not on the top of everyone's favorite person list, but those experiences are changing, especially with the comfort that we can bring to people in the dental clinic, and as well as the smiles. A lot of people are coming and say, I want a beautiful smile. And people started coming back to the dentist because they wanted those services. And so that was a wonderful, wonderful time. It still is. Giving somebody back their smile is one of my favorite things to do. It's a harder world to live in if you're not comfortable with your smile. So you really feel like you've given your people their lives back.
Yeah, it's funny. We were at the American Association of Oral and Systemic Health, I guess 2 years ago, maybe 3 years ago in Seattle, and we're sitting around with a couple of people from Clear and some dentists, and they said, how do we get this message out, the importance of oral health? And one of the hygienists that was attending she says, people don't want to hear about oral health. They want to hear about kissably fresh and brighter, whiter teeth. And we all sat there and we said, well, we're like defeated before we even started. And he said, no, well, you have to tell them that the getting the mouth healthy, the bacteria right, oral care up, and you will have, as a side effect, whiter teeth, fresher breath, but you'll also live a longer, healthier life. So it was pretty interesting. I mean, the oral and systemic realm of dentistry offers a lot of things in detecting serious medical conditions that traditional medicine can't. And what are some of those things?
Well, what's amazing is now that we do saliva testing, you may have harmful, high-risk bacteria living in your mouth. You might even have great clinical signs. You might not even have any bleeding. And you may feel like your mouth is healthy, but you don't know and you can't guess, so you have to test. And the test is a saliva test where we do an oral DNA analysis of the top 11 bacteria that are involved in gum disease. And a number of those are high risk, meaning that not only are they harmful and can cause potential damage to your gum tissue, the bones that hold your teeth in, but once these bacteria get into your bloodstream, the latest study that came out in the British Medical Journal in November shows that these high-risk oral bacteria are causative of atherosclerosis. It's not just like, oh, maybe it's connected or maybe it's influences. No. Those, we don't talk like that anymore. The high-risk oral bacteria involved in the mouth are causative of atherosclerosis. And atherosclerosis can lead to heart disease, heart attack, stroke. Atherosclerosis is the number one killer for almost the last 100 years. So all of a sudden, dentistry is thrust into the national spotlight for being absolutely the place to get that mouth health under control. Not only will it help you have fresher breath, brighter smile, but it can also keep you and help prevent you from getting a heart attack or a stroke or a whole host of other diseases that these high-risk bacteria are causing and contributing to. When these nasty bugs get into your bloodstream, it's almost like it sets your whole circulatory system on fire. It's a quiet fire, Dan, because you can't sit there and just feel the inflammation that's going on in your body, and that's why it's so dangerous. So we test for saliva in our office, and that's part of the protocol to really getting people healthier, not only just mouth healthy, but body healthy. And that's the whole side of gum disease that we're trying to educate people to make sure they understand that part, because it's the part you can't see. Like I said, we can't guess anymore if it's there or not. We have to test, and the saliva test is an easy way of doing that. Now, if we don't have saliva tests, certainly what a lot of clinicians will do, they do the clinical signs, like, for example, is there bleeding or is there bone loss on the X-ray? Is there, the signs, are the gums shiny, red, and puffy? That's the clinical side of dentistry, and dentists and hygienists look for that. But once again, the other half that the whole profession is not seeing, unless they're doing saliva tests, would be these levels of the high-risk bacteria. So remember that guy on the TV commercials that says, like, what's in your wallet? Now we're saying in the dental realm, what's in your saliva, and what we're finding in the saliva that is so dangerous is the bad bacteria. And the physicians themselves are saying, we had Charles Whitney, who was the president of the American Academy of Private Physicians. He says that physicians often can't improve vascular inflammation without identifying and treating existing high-risk oral bacteria. And, Dan, that's exactly what I'm talking about.
And what is the Bale-Donin study? It showed a link between dental bacteria and heart attack. Can you give me some background on that?
You bet. The Bale-Donin study is exactly that. It was the study that was published. It was a peer-reviewed study published in the British Medical Journal. It was the study that first identified periodontal disease due to these high-risk oral bacteria as a contributing cause of cardiovascular disease. Once again, that's the leading killer of men and women globally. So that was a very, very landmark study, waking up the entire dental industry. Unfortunately, Dan, news in the dental circles doesn't travel very fast. That's why I'm thankful for shows like Clinician's Corner Radio here, because we're getting this information out to people. They need to know this. So Bale and Donin have been mentors of the American Academy for Oral Systemic Health ever since its inception. And this particular study that they looked at was a 2016 meta-analysis of pooled studies of more than 7,000 people, and found that those with periodontitis were twice as likely to suffer heart attacks compared to people with healthy gums. And they were the ones that connected these high-risk bacteria to causing atherosclerosis. And there's a triad of things that contribute to atherosclerosis. First of all, it's the fats going in your bloodstream. It's the permeability of those fats into the lining of your arteries, and it's the stickability of those fats. In other words, if the fats weren't sticking in the linings of your arteries, we wouldn't have a problem, because they'd go into the lining of the artery, then they'd go out back into the system, your body, and the lymph system would flow them away. But because these bad oral bacteria make these fats penetrate the lining of the artery and then stick there, makes them so dangerous and so harmful. And that's why we call them high-risk bacteria. And so there's life-saving implications that are going on in these saliva tests that we're doing in dentistry. And we want to knock these bacteria down. And the way we do that, of course, is the therapy, periodontal therapy. There are oral probiotics that you can use, just like the probiotics for the gut. There are specifically oral probiotics that will build up the good bacteria in your mouth, which is always in competition with the bad bacteria, the bad high-risk bacteria. So you want to support the good bacteria. Then you want to also use products like xylitol, like the clear products, the spry xylitol products, because this is one of the most amazing things in all of dentistry is that this is a sugar. It's actually a sugar alcohol, but it tastes like sugar, and the bad bacteria cannot metabolize it. And so the more they consume it, the more they are rendered harmless. And also the bad bacteria, like that clump together, which we commonly call plaque or biofilm. Collections of this bad, tooth decay causing bacteria can form on your teeth. But when you're constantly consuming xylitol, the xylitol actually attaches to the outer membrane of the bacteria, and bacteria can't stick together as well. So the whole concept of bacteria growing and growing and forming this plaque and this biofilm, and then this plaque being so closely stuck to your tooth, and then any sugar that they consume, the byproduct is the acid that gets laid down on your tooth structure. That is so much harder to happen when you take that power of bacteria away. You sort of strip it of its power to stick together and to stick to teeth. And the more that they consume the xylitol, which they can't metabolize, the more that bacteria is rendered useless. This, to me, is cover story material for not only dental journals, but I'm just saying across the scope of media. This is important information to get out there.
It's Clinician's Corner with Dan Cahigas. Here's Dan.
You've referred in past discussions in some of your literature about gums of steel. What is that?
Well, when I got so irritated with the health of gums in America and how bad is it, let's just talk about that for a second, too. Because gum health, like I said, it's the number one chronic inflammatory disease of the entire body. And the Surgeon General has come out in a report saying that 80% of the population has gum disease. The Centers for Disease Control says more than half of American adults suffer from gum disease. So, Dan, the red flag and the alarm should be sounding that this is the most chronic disease in America, and so with all this disease going on out there, you would think that it's being treated, but I can tell you, Dan, it is not. And even for patients that go in and they get their 6-month cleaning regularly, that procedure is not designed to treat gum disease. And if your dental team says, yes, you had some bleeding, I want you to floss more, if they even tell you to floss more, I would turn around and say, well, why? Tell me why I need to floss more. They say, well, you have some bleeding over here in your pocket's getting deep there, and then I would say, well, is that gum disease? They might soften. They might say, well, it's a little bit. No, you don't want any gum disease. But even if they say it's gum disease, then you got to say, then did I just get the wrong procedure? Because the 6-month cleaning is designed to be here's the catchword, a preventative procedure, meaning it's designed to prevent you from getting gum disease. If gum disease is already there, then you need therapy. You need a different procedure, and that's why I created the Gums of Steel protocol to identify, diagnose, and treat gum disease so that we don't continue to allow our patients to have a chronic inflammatory condition in their bodies that continues 6 months after 6 months, year after year, and these diseases that are killing us are from chronic inflammation. And so let's put out the fire that's going on in people's mouths. And that's why I created the Gums of Steel protocol, which is basically sounding the alarm, not accepting dental disease, not accepting gum disease as being, oh, it's not so bad, it's just a little bleeding. That's crazy. That's crazy talk. Gums that are bleeding are on fire with chronic inflammation, and you need to get, when you go to the dentist, they need to probe every single tooth, measure 6 points around every single tooth to find out if there's bleeding in the areas that you can't even reach. Dan, a lot of people out there floss their teeth, and I will tell them that the majority of the people out there that the floss cannot reach all the way around the tooth. Especially you can't reach in anything that's even a 3-millimeter pocket or a space between the gum tissue where the crest of the gum is and where it's actually attached to the tooth. So a lot of people are out there flossing, thinking I'm doing a great thing, yet they may not even be able to reach the harmful high-risk bacteria. And the worst bacteria lives in the deepest part of the pocket, which is that deepest part between the gum and tooth where the gum is finally attached. And so they're just unaware that they've got this chronic condition, and I'm disappointed that the dental profession at large is allowing people to have this, because the insurance statistics tell us, like I said, if between the Center for Disease Control and the American Dental Association agree that it's somewhere between half of all the public out there and 80% of all of the public out there, then you'd think that when the dental insurance claims come in, that a large percentage of them would be for periodontal therapy. But 90% of them are coming in for these cleanings, these 6-month cleanings that, once again, are by definition not for anybody with gum disease, and it's a preventive treatment for people that don't have gum disease to keep them from getting it. So that's my beef, Dan, and that's why I decided to create the whole Gums of Steel concept for diagnosis and treatment and get this gum disease under control for healthier mouths and healthier bodies, and that's kind of that's it.
Well, you know, part of this whole program revolves around the use of products like Spry dental products, the Spry gum, the mints, the toothpaste, the oral rinse, all of those things on a regular basis. And, you know, I go to the dentist every 6 months like a good patient, and the dentist always comes in after the hygienist goes through, and he says, you know, if everybody had teeth like you, I'd be selling shoes. So
right.
People get it. But, you know, I mean, dentists get it that, you know, there is an education program there. There are products, and he always asks me, what are you using? And I always tell him. And, but, you know, unfortunately, a majority of the people don't get that. Now, we're running low on time, but there's a very interesting part of all your accomplishments over the last 20 years. You've earned the nickname as the Rocking Dentist, the Rocking Dentist.
Yeah.
What is that about?
Well, Dan, I believe that there's many ways of getting the message out. And if I can get somebody's attention by being a rock and roll dentist, I will take to the stage in my silver sequin suit and my giant toothbrush that shoots confetti and CO2 plumes of smoke, 20 feet in the air. And I've recorded a number of
at Oral
songs. I've been acknowledged as the singing dentist on David Letterman's late night show.
I have video of you on my cell phone to prove it if anybody wants it. At Oral Systemic Health 2 years ago, you've had the whole show, the glitter, the lights, everything, and I videotaped it. We ran in to make sure we caught your performance.
Yeah, I even auditioned on American Idol, and the 25 million people saw my shtick. And I said, whatever it takes to get their attention, I have a very powerful message, so I'm not about to lose the fun side of my personality. But I just, I can go down the serious road, the study road, the straight talk road. But some people have to come through that door of entertainment to get their attention, and I'm happy to walk through that door because whatever I can do to get our nation healthier. We've got a healthcare crisis going on right now, and we're going to go bankrupt as a country if we can't solve it. Let's have the dental profession lead the way with early systemic signs that we're looking for and get them under control and lead the way for a healthier world is kind of what I'm all about, Dan.
Well, let's let our listeners know and remind them that Spry dental products like the Spry, the gum, the mints, the toothpaste, or rinse are all available at Vitamin Shop, Whole Foods, Sprouts, and other fine health retailers nationwide, as well as Kroger stores nationwide. And for a complete list of retailers, you can go to Clear. It's spelled XLEAR.com. That's XLEAR.com. Dr. Kammer, I want to thank you so much for spending this time with us here in New York, and we hope to have you on again soon. And, Doc, it was great. Glad to have you.
Thank you for having me, Dan. It's an honor to communicate, and that's how we change the world, with education. And thanks to your show, we're getting it done.
All right, and that was Dr. Chris Kammer. For more information, you can visit clearxlear.com, or again, visit Vitamin Shop, Whole Foods, Sprouts, Kroger's, and other fine health retailers nationwide. This is Clinician's Corner, and we'll be right back.